want to talk to you about the most important part, I think, of a key marketing piece when it comes to your patients and prospective to get attention. And you want to make sure you nail this one, so you're going to want to come right back. I'll see you in just a sec. Hi, I'm Ginger Bratzel from New Patient Attraction Automation and gingerbratzel.com, where we work with our private clients and our students on strategies, programs, and trainings and coaching to get them to the next big level when we tie management, marketing, and mindset together to make a very successful dental practice. And today I want to talk to you about my favorite topic that I get the most questions on is marketing. So people will ask me, Ginger, what's a good marketing piece? What's the offer do I need to do? I've talked about this numerous times because it's always coming up. I always get this question, so it's a valid question. But when it comes to someone looking at your marketing piece, so either they're reading it, they're watching it, they're seeing it, they're hearing it, whatever the case may be, you've got to grab their attention right off. And we do that with what we call the headline. The headline is the biggest thing out there on your marketing piece. So this is the first grabber if we heard it in audio. It's like a commercial. And if it's video, it might be me saying it, but also might be text. But this is what grabs them first. And it's got to be emotional, and it's got to be compelling. And it's not about you, the doctor, or the practice. It's about them. It's always about them. You always hear me talking about them. So to get a great headline, you've got to come into the head of what would the perfect patient want to know? What is really churning in their gut? What's keeping them at night? That's our headline. So it's the biggest thing out there. If it's a billboard, this is the biggest lettering out there. It is not your photo of you or your office or your name or even your phone number. We want those things to be readable. But this is the most compelling thing, because if you don't grab them at the headline, they will not listen, they will not see, they will not look, they will not read to anything else you have to say. So this headline has to be really compelling. And so I like to follow some simple rules when writing a headline. I find some of the best headlines are written in the form of a question. So I ask a question. Are you struggling with? Are you frustrated by? Are you looking for an answer to XYZ? I ask them a question. That's engagement, because they have to answer that question mentally in their head. And so now I've made a hook, a connection to them. So that's my first point. The second thing I've already teased about is emotional to them. If it's emotional, something that's bothering them, something they hate, they're frustrated by, embarrassed by, those are very strong emotions. So I, through my research, always ask what my target audience is frustrated by. What do they hate? What are they embarrassed by? And they'll tell me exactly. And a lot of times in those headlines, I will take what they use in their phrasing and use it verbatim as my headline. So they tell me they have a terrible toothache. They don't have a dental emergency. They have a terrible toothache. I have a bad toothache. I don't like that grammatically. And as the professional, you feel compelled to change that, but that's what they're saying. It connects with them, it resonates with them, and it's a form of question. So when I do a headline, I'm only emphasizing one thing. So I'm not doing every dental procedure in the world. I am doing one topic, and if I have more than one topic, that's going to be a whole separate marketing piece. So I'm only doing one marketing thing, and everything I'm going to talk about goes to that headline. And I will sit down and write that question about 15 times in 15 different formats. The first time is never the winner. And what you're doing is training your brain to tease that out. And you'll look at it, the 15 of them, and you'll say, number 3 is great, the first part, but I like the number 7 second part. And that's how you're going to come together and make those really compelling headlines. So your headline, honestly, is the most important thing, because if you don't grab them there, nothing else matters. So think about it. Even if you're sending a letter, that letter, if they're looking at it, that's a headline. And if it's not compelling enough for them to open up to read the next, you failed. Your subject line in an email is your headline. So what is the first thing you want to grab their attention that's all about them, that gets into their situation and it resolves their issues? That's what we want to do. So your assignment is to pick a topic, something you'd like to market on this week, and write 15 compelling headlines. And I'll tell you, most of them are going to stink. That's okay. But don't stop until you get to number 15, because that's how we tease the gold out. and then you will build your best headlines through there. So that's my exercise for you for building marketing pieces. It's something I do myself in my office. This is what I teach my clients. You never hit it first time, so do it 15 times. So go off, work on your marketing headline, and get that done this week so you can start marketing your practice in a positive way and to grab the right patients for your office. Till next time, this is Ginger Bratzel, signing off. Bye-bye.